1450 FM 99.3 KNSI. Welcome back to Your Health, produced in association with CentraCare. Today, we are talking lung cancer. It is time to raise awareness about lung cancer because it's not going away. We need to do more. We need to know more. We will find out about the causes of lung cancer. What about lung cancer screenings? Exactly what is lung cancer? Radon is going to rear its ugly head in this conversation, and what to do if you have symptoms, how to recognize those symptoms of radon exposure. Our guest is Kayla Hess. She is a cancer care coordinator and a nurse at CentraCare. Kayla, thank you so much for joining us today.
Thanks for having me today.
So the first question, obviously lung cancer. Golly, I guess the first time I learned about it was when they came out with a little warning label on the pack of cigarettes back in the early 60s. Tell me, though, what is lung cancer?
So basically, cancer in general is just abnormal cells that replicate themselves. Lung cancer means that it is located in the lungs.
Okay. Are there more than one type of cancer that can, I guess, attack our lungs?
That's a great question. So there are multiple types of lung cancer. Typically, they are diagnosed by doing a biopsy that then gets sent to pathology and then tells you what type of lung cancer you might have.
Would there be different types of treatment for those various types of lung cancers?
There are, yes. There are options between chemotherapy, immunotherapy, and radiation or surgery nowadays.
Well, it's a good thing that you're here because I just thought there was one kind of lung cancer, and that was that.
Yep, that's a great myth. So I'm glad we can talk about it today.
I love busting myths. Good stuff. The best way, the only way to find out if you have lung cancer is to have that lung cancer screening?
So that is one way. So lung cancer screening, what is done is they use a low-dose CT scan. Takes less than 10 seconds.
Right.
There's no medication given. You can eat before and after the scan. You can leave your clothing on as long as you don't have metal in your chest. The only thing is you have to hold your breath for about 6 seconds while the chest scan is completed. And they recommend doing these annually, and it's to try to find those cancers at an earlier diagnosis, an earlier stage. And that just means that it's easier to treat.
You have piqued a couple of questions here. Okay. Who gets lung cancer? Men, women, boys, girls? Does it not matter?
So typically, cancer ages are between, in the older generation, they're typically caused by things like smoking is the leading cause. The second is radon, which we'll talk about.
Sure.
A great option for this lung cancer screening is if you're in between the ages of 55 to 77, if you're a current smoker or have a history of smoking in the past 15 years, if you've smoked a pack of cigarettes per day for the last 30 years, and have not had a CT scan in the chest in the past 12 months, you should really see your primary care provider and request one of the screenings.
Are you at all involved? Have you seen any vaping things come in through CentraCare where you work?
Me personally have not. It's very new.
Yeah.
The Minnesota Department of Health is coming out all the time looking at new things right now. It's a big thing in the news.
Oh, for sure.
That they're talking about. So right now we're really in the learning process as far as what the side effects and what's happening with this vaping. So it's something we're looking into.
How did you get involved with lung cancer and screenings and all of that kind of stuff?
Sure. So I started at the Coborn Cancer Center about 3 years ago in the triage role.
Sure.
So I dealt with a lot of side effects, management, things like that.
Right.
And I recently went over to the care coordination. So I'm specifically a lung care coordinator.
Okay.
So I treat patients or help patients with their treatment when they are diagnosed with lung cancer.
So do people come in because they've had a nagging cough or they just can't seem to shake this cold or something?
Yes. So a lot of people will either find it either through this lung cancer screening. They have annual ones. Other ones will end up just having either a cough, they're coughing up blood, they're having some chest pain or shortness of breath, or even just getting a lot of like pneumonia or bronchitis.
Yeah.
That leads to a chest x-ray, which can lead to the CT scan, and that's typically how it's found.
But there are people that are perfectly healthy in any other way, shape, or form, right? They're just walking around and boom, they can get lung cancer.
Yes. A lot of people will not have any symptoms.
Yeah.
And so some of these are incidental findings, which is why we encourage, if you do have those, are current smoker, past smoker, you should get these scans tested annually, basically to try to find it at an earlier stage, because a lot of people don't have symptoms until they're already in stage 3 and 4, which is the ending stages.
Right. Now, secondhand smoke, do you find that is a cause of lung cancer?
It certainly is. Yep. So if you have a history of a secondhand smoke, that would be another reason to be tested.
Okay. I can think of a whole bunch of other things. You were talking about, a shortness of breath, a nagging cough or whatever, but that can mean many other things, right? That could be COPD, any kind of other lung issues.
It could be. So what we suggest, if you are having any of these symptoms, to start with your primary care provider, have them do an assessment, and go from there.
Have you found that lung cancer is a genetic predisposition at all yet?
There are some genetic history that we look at. So that could be one case, but there's other. The most is smoking and radon exposure.
Okay. Oh, and filters make a great difference, don't they?
There is no evidence that I am aware of.
Not so much.
Between that.
All right. What about other cancers that may pop up in the body? Bladder cancer, for example, right? Can that spread to the lungs? Can you get lung cancer from other forms of cancer?
So what they do is you can have other cancers, and if they spread, that's known as a metastasis.
Metastasize, right?
Yes. So, but if you have a lung cancer, that means that it starts in the lungs. It does not mean that it can't go other places.
Okay.
But if you have a bladder cancer, you would be known as having bladder cancer that has spread to the lungs.
Gotcha. Folks, we're going to school today. I certainly know that I am. Our guest in studio is Kayla Hess. She is a cancer care coordinator, a nurse at CentraCare. We've talked a little bit about radon. We are going to talk a lot more about radon. It's the radon season in Minnesota right now because the weather is cold outside. Stay with us, folks. Much more to come. You are listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. We're talking lung cancer. Kayla Hesse is our guest. Kayla is a cancer care coordinator, a nurse with CentraCare. And Kayla, one of the things, when we went into that last break, one of the things that we did not get to was we know what happens, before the cancer screening, the lung cancer screening. You mentioned it's just like seconds to get it done. What happens afterwards? What's the downtime like is there time, do the slides have to be developed and all that kind of stuff anymore, or is that old technology?
So what happens after your screening, if your scan shows something that looks abnormal, we will call and schedule an appointment to talk about the results.
Okay.
The scans typically take about 24 hours, and then they're reviewed by the provider. So it can be a couple of days before you might hear something. If there's no problems that are found, then you'll receive a letter that gives you follow-up recommendations, whether to continue to test annually or if you have symptoms sooner.
Go see your primary care physician. Apparently you've got bronchitis or whatever.
Exactly.
Okay. Mm-hmm. Now, what if the news is not so good?
So then we schedule an office visit, and that would be through whoever is ordering the CT scan for you. They would be the ones that you would see, and they would kind of explain the process as far as here's what we do next.
Okay. What are some of those things that you do next?
Sure. So what happens is typically the primary care physician may send a referral to the oncologist saying they've had a CT scan. It shows maybe some nodules, which are quite common. From there, they usually do a biopsy, and that is to make sure that they have a positive lung cancer diagnosis. Sometimes the nodules are benign, meaning there's no worry, and we just watch them.
Yeah.
So if it were to become back positive as a lung cancer, then typically you hear from me. We usually order a PET scan, which is a scan from your chin down to your mid-thigh. It just looks at the whole body. We also do a MRI of your brain. And that's to make sure before we see you that we know all the concerns that we're looking at. So that way we can make the best plan of care for you. Okay,
now that sounds like an awful lot of tests being done, right? With things that I don't really know what they're doing to me.
Sure.
Plus, I think back to all of these zillions of x-rays that I've had on my mouth for all the cavities that I have. Mm-hmm. Is that a problem being bombarded with all of these rays?
So it's really not. Nowadays, the radiation doses, which I've heard concerns about before, are very small. we also look at the pros versus the cons. This is something that we want information for so that way we can treat you to the best of our knowledge.
I'm so glad that that's what the answer is because, again, you always hear so many different stories about this, that, or the other thing. Now, nice to get the facts. Thank you. So the cost of cancer screenings, I guess, would depend upon the number of tests that you have to have. If the first one comes back negative, you're good.
Yes. So, lung cancer screening in general, screening is usually covered by most insurance plans. Each plan can vary, so we do recommend checking with your insurance provider for coverage information. But if you ever have questions, you can call the CentraCare's price quote line. That's at 320-251-2700, extension 53129.
Before we get into the whole radon deal, what's the magic answer about people who smoke for 50, 60, 70 years do not get lung cancer, And then there's somebody just driving by somebody that's smoking in their car, and yet they come down they develop lung cancer. How do you know?
That's a great question, and the answer is you don't. It's really almost smoking increases your chance significantly. Secondhand smoking increases your chance. Radon exposure increases your chance. But as far as who gets lung cancer and who does not, it's up to the higher power.
Up to the man upstairs. For sure. So what about some of the other things that we always hear about? There's some thermal inversion that's keeping all the particulates down here. And if you have lung issues, don't go outside today. Don't exercise outside, that kind of thing. Those people are predisposed to lung issues, right? We mentioned COPD and that kind of stuff. If folks have, what I would term bad lungs, if you will, are they more apt to develop lung cancer, or is it too hard to tell?
It's hard to tell. People who do have COPD and get chronic infections and such do have higher incidences of lung cancer.
I worry about asthma and all that stuff too,
I haven't seen any statistics, but it could be. I haven't looked into that quite enough to be able to tell.
Again, this is where your primary care physician really comes in.
Exactly.
Play. All right. Let's talk about that nasty gas called radon. What do you know?
So radon is a colorless, odorless gas. It's not something you can see, smell, taste. Comes up from the soil. Minnesota has 2 in 5 homes in Minnesota have radon levels that pose a significant health risk.
Yeah, that's 40%, folks.
Yes, because Minnesota homes are closed up and heated most of the year, that can result in those higher levels of radon. What radon is basically produced from a natural decay of uranium and radium. It's found in rocks in the soil, which is why Minnesota has just a higher incidence. It breaks down, the uranium breaks down to radium, and then it eventually decays into the gas radon.
Okay.
So what happens is radon gas is in the soil, it gets pulled up into your home, and that leads, because we have the closing and the heating all winter, leads to those higher levels.
So think about this, folks. In the summertime, right? Every place is nice and roasty, toasty, warm, right? That's what the radon gas likes. Gas goes to warmer places. Your basement, specifically in the wintertime, that's where everything is really nice and warm. And think about it. Outside, it's really cold. So if you have cracks in your basement floor, if you have a sump pump that is not properly capped, that is where radon gas can get into your house. If you don't have proper fresh air coming to your furnace, right, sucking air in from the outside, there's going to be a suction from inside in your basement, and that will in turn have a propensity to pull more radon gas in through that sump pump and any cracks. So radon mitigation can be done, correct?
Yes, and is encouraged
if
you have levels that are higher and recommended by the Minnesota Department of Health.
Now, I don't see you wearing a radon mitigation outfit or anything like that, but do you have information on how we can get that done?
Yes. So if you have a test that has positive and it comes up as recommendations to have a mitigation system, you would want to go to the website. That is the Minnesota Department of Health website. It's at www.health.state.mn.us/radon.
Okay, now they have a little test. Did you just hang something up in your basement? Follow those directions like that. However, to be really spot on, get a pro in there to take care of it?
Yeah, so there's a myth on this as far as it comes from the heating system or the furnace, or I have electric heat, I can't get radon.
Right.
So those are all false.
Right.
If you find that there's two different types of radon testing, there's a short-term and a long-term test. A short-term is over 3 to 7 days. You can buy one online. You can get them at
any big box store.
Yes. So if that comes back that it has a high level as 4 or higher, they recommend doing an additional test of a long-term test. That's anywhere from 90 days to a year. If that comes back positive, then they would suggest you looking into a mitigation system.
You know, I don't want to scare the heck out of people, but it is kind of a serious deal. I mean, I look at my house when my family gets together. You're in the basement. We're watching TV. That's where our Christmas tree goes. All these things. That's where the spare bedrooms are, right? It's nothing to fool around with.
And it's not only in basements, even if you are on
it circulates throughout your house.
Yes. So if you don't even have a basement, whether you live in a mobile home, whether you live in a 3-story building, if you don't have a basement, these all homes, new or old, can get radon. So it doesn't matter what kind of house you live in, we always advise to check.
Kayla Hess is our guest. She is a cancer care coordinator with CentraCare. We are going to take a break. When we come back, we will talk about radon continuing, and we're also going to get a little bit deeper into this whole issue of lung cancer. You are listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Welcome back to our final installment of Your Health. Today, we are talking about lung cancer awareness. Kayla Hesse is our guest. She is a nurse with CentraCare, in fact, a cancer care coordinator at CentraCare. Kayla, when it comes to lung cancer and radon, let's talk about the symptoms, first of all, of radon exposure.
That's a great question. So for radon, there really isn't any symptoms that you'll have. What you will have due to radon exposure, high levels, is symptoms of lung cancer, which would be that persistent cough that we talked about, possibly coughing up blood, shortness of breath, some chest pain, frequent infections like that bronchitis or pneumonia.
But does that mean then that I have lung cancer if I just have those symptoms from radon?
It does not mean that you have necessarily lung cancer. If you have these symptoms, again, we just recommend you check with your primary care provider, and they will do follow-up things such as that CT scan that we've been talking about.
So I come in there, I may be coughing up a lung, so to speak, pardon the pun, and I'm okay. Then that's when the whole next series of tests and that radon mitigation come into play.
Correct.
Gotcha. When someone is diagnosed with lung cancer, what are the treatments that are available to those people? I mean, I automatically think of the worst case scenario. There's nothing else to do, Bob. We have to get a lung transplant. Does that happen very often?
So in my experience, it has not happened very often. I am also rather new with only about 3-4 years of experience. Typically what happens is when you see your oncologist, they are going to do what's called staging of your cancer. Depending on what stage you have, that will then depend on your treatment. So the treatment options right now are chemotherapy, immunotherapy, which is very similar to chemotherapy, and then radiation and or surgery.
Okay.
Surgery typically means that if the lung cancer is in a specific spot in your lung, they might just do a lobectomy, meaning take out part of the lung or even just the spot that they have found. So it really just is dependent on what type and how far along you have.
How many of these cancers, how many is this common? Like, do you deal with a lot of folks with this at CentraCare?
I'm specific to lung cancer, so that's all I deal with.
Sure. But when you look at lung cancer as opposed to other forms of cancers that are out there?
Yes. So in Minnesota, lung cancer is the second most common cancer diagnosis, and it's the leading cause of cancer mortality.
Okay.
Lung cancer kills more than twice as many men as prostate cancer and more than twice as many women as breast cancer. So the fact that it is a more common cancer as well as the mortality rate is higher because we are not finding you have symptoms until you have that later stage. So doing these CT scans are so important to find you at an earlier stage to cure.
I'll tell you what's more important than that is getting that radon test done. Because if you don't know that your house is filled with radon until it's darn near too late,
correct,
this could really be a game changer.
Yes. Finding that radon, getting a mitigator to put in a system, finding those high levels of radon are extremely important.
So I think about the kids again, right? Your little kids are running around down in your basement. Can they be, have you ever had kids come in there with those?
So we only see people 18 or above.
Okay.
So I don't see children, but it's usually radon exposure over years. So finding it early is the best way to prevent.
Yeah. Get the screening.
Yes.
All right. Again, Kayla, let's make sure people understand. If you are having the symptoms of what? So
cough, shortness of breath, chest pain, coughing up blood, frequent infections like a bronchitis or pneumonia, see your primary care provider.
Put the smokes down.
Exactly.
Right.
Check for radon.
And listen, smoking is everybody's favorite whipping boy. I get all of that. But I'm thinking it's going to be paling in comparison to this whole vaping issue that's coming up. You know, and we haven't even talked about the push for legalizing recreational marijuana yet, which I think is so ridiculous because look at the pack of smokes. It can be hazardous to your health, my friends. Mm-hmm. Why would you do that?
You know, I don't know. I'm not a smoker. I'm not a recreational user by any means. I would encourage, these are things that are avoidable. You choose to do it. So if you're looking for resources, call CentraCare. We have them available for you if you'd like to quit.
Do you stand out in the middle of a busy freeway? No. Why would you keep playing games with your life? Make sense?
Exactly.
Kayla, thank you so much.
Thanks for having me.
AM 1450, FM 99.3, KNSI. Our guest, Kayla Hess, Cancer Care Coordinator at CentraCare. One more time, you gave out a phone number a moment ago.
So the phone number is for if you have any questions about insurance or just a general number if you have questions and would like to talk to someone is 320-251-2700.
Kayla, thank you again. AM 1450, FM 99.3, KNSI. You have been listening to Your Health.